Liver transplantation for metastatic neuroendocrine cancer is a fairly simple operation. It's an easy operation from a technical standpoint since there is no underlying cirrhosis and no portal hypertension. And patient survival after transplantation is comparable to the results achieved with other acute and chronic liver diseases and malignancies. David Nagorny was helpful in to provide me with this overview slide showing various series reported in the literature of liver transplantation for metastatic neuroendocrine cancer. As you can see, most of the series are quite small. Ours here was published in 2006. Median follow-up is fairly short at only 37 months. 1-year survival overall, as you'd expect, is greater than 85%, which is at least baseline results for liver transplantation. And 5-year survival is approximately 50% or just a little bit above, but very few patients, if any, remain disease-free 5 years after transplantation. Lehnert reviewed 103 patients in the literature, and the overall survival was pretty much as expected, and recurrence-free survival was much lower. He made an attempt to try and delineate some of the prognostic factors, looking at age less than 50, primaries in either the lung or the bowel, or octreotide sensitivity show it was a favorable prognosis, and looking at those patients that had no favorable factors, their survival was worse than those that had one or those that had two prognostic factors. However, what we've been able to do really is to describe outcomes after liver transplantation. Nevertheless, we really don't have an idea of how these patients would have done without transplantation, and that will become a key point. So the question as far as liver transplantation when, I'll conclude by telling you that it's probably indicated at some times, but I really don't know. Now, what are the aims of therapy? What's the aim of performing a liver transplant for someone that has metastatic neuroendocrine cancer? Well, the one aim might be to palliate any hormonal syndromes, and it's certainly effective at that. The other aim, though, is to prolong survival. With palliation of hormonal syndromes, we can certainly do that. Removal of the liver can clearly achieve resolution of these symptoms, at least for the time being. However, with prolongation of survival, although we can achieve satisfactory patient survival after transplantation for these patients, the frequent early recurrence and the nearly universal